Today I have with me Mayor Pro Tem Dave Martin and representatives from Police and Fire, Office of Emergency Management, and Dr. Persse, who's here today. Today, Texas is aggressively moving forward to reopen businesses in Phase 2 of the state's plan. I also want to see the economy move forward, and I think we all do. Want to see the economy move forward, and I want people to get back to work so that they can provide for their families. But I also want to make sure that it is done in a safe and responsible way. And since March, Houston has taken steps and made sacrifices to prevent the spread of COVID-19. And again, I want to thank all Houstonians who have helped us to achieve the, and I won't say success, but to help to flatten the progression of this virus. And we certainly have achieved that objective. And we have, up to this point, kept this virus from overwhelming our healthcare delivery system. And I want to thank the people in this city for their efforts. Our efforts have saved lives and prevented our local healthcare system from being overwhelmed. I don't want us to lose sight of the fact that the virus is still in our community, and I think we all recognize that. And I do not want anyone to let your guard down or not think that the virus is no longer a threat to our health and safety and the health and safety of our family, friends, and neighbors. And as a reminder, today the Houston Health Department is reporting 139 new cases of COVID-19, bringing the total case count for the city of Houston to 5,795. The total number of deaths in the city of Houston will increase by 1. So we're reporting 1 new person who has died as a direct result of COVID-19, and that brings the Houston count to 115. This is a white male in his 80s with underlying health conditions who passed away on April the 22nd. And so as you can see, we must continue to remain vigilant even as restrictions are being lifted, and we must contain the spread of the virus and keep Houston safe. As the state of Texas moves into Phase 2, continuing to go to restaurants whose occupancy restriction now goes to 50%, to bars and summer camps, bowling alleys, and concerts, and back to work. Please, let me emphasize the importance of wearing face coverings and practicing social distancing and good hygiene. All of those things will be critically important. And as more businesses reopen, Houston will benefit from easier access to free COVID-19 tests. The Houston Health Department and its partner agencies are providing 113 testing sites across the city this week. I said 113, 13 testing sites across the city this week, focusing on vulnerable communities. And there's a map with all of the locations, and I want to thank the Texas Division of Emergency Management, which is working with the Houston Health Department on 4 drive-through test sites at these various locations. And also this week, Kroger Health and the Health Department will operate a free drive-through test site at the Acres Home Multi-Service Center at 6719 West Montgomery Drive, and that will take place from May 19th through the 23rd. And United Memorial Health Center and the Health Department will extend operations at an existing site and open 5 new drive-through sites this week at Funwood Early Childhood Center at 9709 Mesa Drive, Forest Brook Middle School at 7525 Tidwell Road, United Memorial Medical Center at 510 West Tidwell Road, Cullen Medical Center at 6900 Scott Street, and Griggs Elementary School at 801 Regional Park Drive. And as we move forward for the rest of this month, the goal is to open a total of 24 testing sites this month, and to increase the number of tests that will take place in the city of Houston. And again, let me encourage everyone, whether you are symptomatic or asymptomatic, whether you have symptoms or no symptoms at all. Let me encourage you to take advantage of all of the free testing sites that exist in the city of Houston. And so let me pause at this point and bring up Dr. Persse for his report. Dr. Persse.
Thank you, Mayor. Two things I'd like to talk about today is we talked earlier about a week or two ago about a new complication, well, not new, but a complication of COVID-19 disease. We mentioned that it was a complication seen in children similar to a known syndrome known as Kawasaki syndrome. For this particular virus, the COVID disease, it now has a name. It's called multi-organ inflammatory syndrome associated with COVID-19. It is still a rare complication. In New York City, where they have many, many, many cases, there's about 100, I believe 102 cases. This is a childhood illness. In New York City, I said about 102, and I think across the rest of the nation, there may be 24 others. So it's still rare, but it is potentially very serious. And so for parents, if your children become seriously ill for no apparent reason, including fever, and then unfortunately the other symptoms can be quite varied because this appears to affect pretty much every organ system, hence the name multi-organ inflammatory syndrome. The children are quite ill, however. So if your child becomes significantly ill with fever or even without, you need to contact your pediatrician right away and get that child treated. Again, this is a very rare complication. So in Houston, to the best of my knowledge, we have not had any cases here in Houston, but I advise parents to keep a close eye on your children. Remember, children tend to have little or no symptoms, so you may not even know if your child was infected with the COVID virus before that. And the other thing I want to mention today is last week, on Wednesday of last week, the state issued guidance for labs that, as Mayor, you've been pointing out our frustration with not knowing the total number of tests that have been done. And previously, only positives were required to be reported to the local health department. That has now changed. The state has issued that all tests, so anybody from a lab who's listening, all tests need to be reported to the local health department. And the health department that the test gets reported to, whether positive or negative, is based on the patient's home address. Now here in the Houston area, our health departments work very well together. So if you send it to Harris County, it turns out to be a City of Houston case, we'll take care of that. But you should try to make it local. In other words, please don't just send all your results to the CDC in Atlanta, because that will induce a huge delay. Don't send them to Austin, because that will induce a huge delay. If the tests are done locally, either try to send it to the appropriate, whether it be Montgomery County, Fort Bend County, Harris County, or City of Houston, Galveston County. Please try to send it to the appropriate health department. It's very important. And then finally, back on the multi-organ inflammatory syndrome, that is a reportable illness. So any doctors or nurses who are watching, that is a new illness. It's a new addition to the reported list, and it's required that you report that to your local health department.